Hi everyone, my name is Kabilin, and today I am going to perform a step-by-step procedure of urinary catheterization for male and female. The introduction of a urinary catheter through the urethra into the bladder for installation or removal of fluids. Urinary catheterization has 7 purposes. The first one is to relieve urinary retention. Second is to obtain a sterile urine specimen. Third is to measure the residual urine remaining in the bladder after voiding. Fourth is to control urinary incontinence. Fifth is to provide access for instilling medication into the bladder. Sixth is to maintain an empty bladder during the surgery. And the last one is to monitor early urine production in seriously ill client. Here are the step-by-step process of procedure for male client. And the first one is to check the doctor's order. Catheterization is only if with medical order. Next is to assess whether client is allergic to iodine or plaster. Provide one iodine is often used to cleanse the vulva before catheterization. Excuse me sir, may I ask if you're allergic to iodine po? No? Okay, thank you sir. Next is to assemble equipment needed. Organization promotes efficient time management. So the next procedure is identify and explain the procedure to the client. This to ensure the right client and elicits cooperation. Hi sir, good morning. My name is Kabilin, a student nurse from the University of Mindanao. May I know your name, sir? Can I check your ID band po? Okay, Mr. Ramos. Today I am going to perform a urinary catheterization in which I will insert a catheter to your penis through your urethra into the bladder for installation or removal of fluids. Is that okay, sir? Thank you, sir. The next procedure is provide a good light. Good lighting is necessary to locate the meatus clearly. Next is to provide a privacy by screening and closing the door or window. The client has the right to be protected from being exposed to others. After providing privacy to the client, replace top sheet with bath blanket. Place waterproof underpad under the client. This protects the bed linen from moisture and getting soiled. Sir, I'm going to change your top sheet with bath blanket. Next procedure is place client on a supine position with the feet apart and drape the client. Good visualization of the meatus is important. Embarrassment, chillness, and tension interferes with the introduction of the catheter. Excuse me sir, I am going to assist you into a supine position. Is it okay to you, sir? Okay. Relax lang po, sir. Then after that, sir, I will expose your private part. Then I will put a underpad with a drape. underpad na po. Then after putting the underpad, sir, I will put the drape na po, sir, ha? Relax lang po. Prepare the urine receptacle and tubing if an indwelling catheter is to be inserted. The tubing facilitates in connecting the catheter to the drainage system. Open the pack and bring it near the perineal area. Placement of the equipment near the work site increase efficiency. Then observe aseptic technique. Sterile technique protects the client and prevents the spread of microorganisms. Squeeze a small amount of lubricant over the sterile OS placed in the sterile field. Organization promote efficient time management. Using sterile pickup forceps, get 2 cotton balls with betadine antiseptic solution from the sterile jar and place on the sterile field on top of the several OS. Open the wrapper or plastic cover of the sterile specimen bottle and drop it on the sterile field. Wash hand and put on working gloves. Hand washing prevents the spread of microorganisms. And do perineal or flushing and discard working gloves after cleaning the perineal area. Cleansing the perineal area prevents introduction of bacteria. Next is put on sterile gloves to avoid cross-contamination of microorganisms. Holding the penis with non-dominant hand. Disinfect the meatus twice using cotton balls with betadine antiseptic solution to cleanse the area and minimizes the risk of urinary tract infection or UTI by removing surface pathogens. Starting from the top, use a circular motion stroke, then downward for each cotton balls and discard. The next procedure is to lubricate 6 to 8 inches of the catheter tip. Lubrication facilitates the insertion of the catheter and reduces trauma to the tissues. Next is to hold penis perpendicular to the body and pull up gently. Hold the catheter in the dominant hand. Steady insert the catheter about 8 inches until urine is noted in the drainage bag or tubing. Advancing an indwelling catheter an additional 1/2 inch or to 1 inch ensures placement within the bladder and facilitates inflation of within the bladder and facilitates inflation of the balloon if fully catheter without damage the urethra. Do not force the catheter through the urethra. The sphincter relaxes and the catheter can enter the bladder easily when the client relaxes. Ask the client to breathe deeply and rotate the catheter gently if slightly resistance is met. Excuse me, sir. Take a deep breath. The next procedure is to hold the catheter securely with your non-dominant hand while the bladder empties. Collect a specimen about 20 to 30 ml if required. Continue drainage according to hospital policy. Next is remove the catheter smoothly and slowly. The catheter is only needed to drain urine present in the bladder and is not intended for continuous use. If fully catheter is used, introduce 5 cc. Gently pull the catheter until the retention balloon is snuggled against the bladder neck. Remove the fenestrated drain. Create a balloon to ensure catheter retention. Maximizes continuous bladder drainage. Proper attachment prevents trauma to the urethra and meatus from tension on the tubing. Attach the catheter to urine bag below the level of the bladder to avoid reflux of urine to prevent infection or UTI. Take catheter to the lower abdominal area. Next procedure is to remove and clean the equipment. Make client comfortable. And label the urine specimen and send to the laboratory promptly. Urine kept at room temperature may cause organisms, if present, to grow and distort laboratory findings. Next is to remove the gloves and wash hands. This to deters the spread of microorganisms. And lastly, do documentation. Today, I am going to perform a removal of an indwelling catheter. The first procedure is check the order on a client's chart. Next is to obtain a 5 to 10 ml syringe and an absorbent towel. Wash hand. Good day, sir. Is this Mr. Ramos? Can I check your ID band, sir? Okay. So, sir, I am going to remove an indwelling catheter, sir. Is it okay to you po? Okay, sir. Sir, in this procedure, you may feel a little bit pain and discomfort, but you can tolerate it. Next is put on sterile gloves to avoid cross-contamination of microorganisms. So excuse me, sir, I will put a underpad there. Is it okay, sir? Excuse me, sir. I will expose your private part. Is it okay to you, sir? Okay po. Take a deep breath, sir. Urine output 100 ml. Next is to remove the gloves and wash hands. This to deter the spread of microorganisms. And lastly, do documentation. Hi everyone, my name is C. Cavili, a student nurse from the University of Mindanao. Today I am going to perform a fully catheter insertion for my female client. So the purpose for this procedure is to relieve urinary retention to the client. Second is to obtain a sterile urine specimen. Third is to measure the residual urine remaining in the bladder after voiding. Fourth is to control urinary incontinence to the client. Fifth is to provide access for instilling medication into the bladder. Sixth is to maintain an empty bladder during surgery. And the last one is to monitor early urine production in seriously ill client. So here are the materials needed. So we have here the bedpan, and assuming that this is a waterproof underpad, the bath blanket, and the tray that contains the following. So we have here the forceps, the lubricant, the betadine solution, the sterile dried cotton balls, the catheter, the drape. We have here the operation sponge or gauze, the kidney basin, the catheter, fully catheter, and the syringe. Here is the 10 cc syringe, the distilled water vial, the plaster, and the urine bag. And so the first procedure is to review client's health record and check client's chart for physician's order. Second is to identify the client and establish rapport. Third is to assess the need of client for catheterization. And fourth is to explain the procedure to the client. Good day, ma'am. My name is C. Cavili, your nurse for today. And you are? Okay, Mrs. Smith. I am going to perform a fully catheter insertion for you today, and I need your cooperation. Next is to provide a good light. Then gather the needed equipment for catheterization and provide privacy by closing the door and pulling the curtain. So after providing privacy to the client by closing the door and pulling the curtain, the next procedure is to replace top sheet with bath blanket and place waterproof underpad under the client's buttocks. Okay, other side. The next procedure is to place in a dorsal recumbent position with the feet apart and treat the client. Next is wash hands thoroughly and put on clean working gloves. Then do perineal care or flushing procedure and remove and discard used working gloves. Then prepare the urine receptacle and tubing if an indwelling catheter is to be inserted. The next procedure is to open the catheterization pack and bring it near the perineal area and observe aseptic technique. Next is to squeeze a small amount of lubricant over the sterile field. Then after that, get 2 cotton balls from the pack and place on the sterile field. Then pour the betadine over them. Then after pouring the betadine over the 2 cotton balls, put on the sterile gloves. After putting on the sterile gloves, the next procedure is to grasp the upper corners of the eye or fenestrated drape and unfold it without touching unsterile areas. Then place eye or fenestrated drape over the vulva area, exposing the labia. With the thumb and forefinger of your non-dominant hand, spread the labia and identify the urinary meatus, and maintain the hold until the catheter has been inserted. With the dominant hand, disinfect the meatus twice using cotton balls with betadine. Next is to lubricate 1 to 2 inches of the catheter tubes. Excuse me, ma'am. I'm going to insert the catheter. Please take a deep breath. Wow. The next procedure is to hold the catheter securely with your non-dominant hand while bladder empties. Collect the specimen if required. Continue drainage according to hospital policy. Remove the catheter smoothly and slowly if straight catheter is used. And if a Foley catheter is used like this, introduce 5 cc or follow manufacturer's instruction of distilled water to secure the catheter. Gently pull the catheter until retention balloon is snuggled against the bladder neck. Resistance will be met. Remove the penetrated drape. attach catheter to the urine bag below the level of the bladder. Take the catheter to that thigh. The next procedure is to place client in a comfortable position and do aftercare of other equipments used. Remove gloves and do hand washing. Label the urine specimen and send to the laboratory promptly. And the last procedure is to document the following: the date and time procedure, and started and ended. Second is the client's response, reaction to the procedure. And the third one is record client's output if required.